Hello everyone and welcome to the Fittleworth webinar for Ostomates, in which today we'll be discussing issues around body image and body confidence. Before we start, Cheyenne is going to explain a couple of things about listening and watching using your computer or phone. So over to you, Cheyenne.
Thank you, Jill. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You've joined the presentation listening using your computer speaker system by default. If you'd prefer to join over the telephone, just select phone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenters by typing them into the questions pane of the control panel. No questions will be answered today. We will collect the questions you have raised today and they will be addressed by Donna Butler and Julie Jones during the Q&A session on the 7th May at 9:30 a.m. An email will be sent to you with a link to register for that event. Today's webinar is being recorded. The recording will be uploaded to the Fittleworth website. An email will be sent to you advising you once this has been completed. I'd now like to hand the presentation back to Jill.
Thanks, Cheyenne. Okay, so now I'll introduce all four of us. I'm Gill Hassan. I'm an author of books on subjects around mental health and well-being. I write books on mindfulness, emotional intelligence, written a book on overcoming anxiety. So that sort of range of area is my specialism. We also have Donna Butler here today. Donna's an integrative psychotherapist. She specialises in trauma. And before Donna was a psychotherapist, she was a nurse. She was a sister in an A&E, an accident and emergency department in Brighton. We have Julie Jones. Julie is a stoma specialist nurse. And we have Rachel Stokes. Rachel is a Fittleworth ambassador, and as an ambassador for Fittleworth, she shares her experience of Fittleworth services and the support to empower other people, just like her, when her life took an unexpectedly different turn. So we'll start with Rachel. And for Rachel, in 2016, at the age of 46, Rachel was diagnosed with a cancerous tumour in the lower bowel. So before your operation, Rachel, I'm interested to know what were your sort of concerns and fears about, specifically about your body, what you felt it would, what did you think about what your body would be able to do or not do? What were the things that came to your mind?
Hi Jill, thanks everyone for joining us. I just really had sort of, I had fears, I had felt every sort of range of emotion from terrified to being positive that I was sort of able to have an operation. But I was just really, I just, I'm before my first operation, I was very active and I was sort of a sporty person, just didn't know how my body was going to be. When I was being scheduled for the surgery, I didn't know when I woke up whether I would actually have a stoma or not. That would need to be decided in the operation. So it was just a lot of unknowns, although I did have good support and good information. It's just something that's just happening to your body, and I just really sort of had no idea how I was going to feel or look.
Interesting then, about about how your body would look. Again, you talked about fears and concerns, and I assume that I'm just imagining that your imagination ran wild, did it, about what, not just what your body would or wouldn't be able to do, but how it would look.
Certainly, yeah. It's I just thought about the I wouldn't be able to ever wear the same clothes again. I had this sort of, I'd only ever heard of anybody who had a stoma had almost like people would just call it a bag stuck there. So I thought, would everybody be able to see the bag under my clothes? Would I be able to, I don't know, be able to not sort of feel confident in myself and how I looked, because everybody would, it would restrict me going out, and I just had, but I really just was not sure. With anything to do with bowel. It's not really something that you talk about in your everyday conversations, or hopefully you don't all the time. So it's something that I couldn't really, you know, at work I couldn't really bring it up with people, and so yeah, I was very sort of apprehensive, but knew that I had to go through it.
Yeah, so a lot of apprehension and unknowns. Julie, can I ask you, as a stoma nurse who works with people that have had operations like this in the past, and you advise them, is Rachel's sort of apprehension and fears and concerns very typical? Is that what you come across?
Absolutely. It's by the time I see a patient, when they've been given the diagnosis and they're told about the type of surgery that they need, I suppose the first thing they realise, the bag on the side, they first think, oh my word, and there's this stigma from the 60s, 70s that somehow now we're trying to address it to raise awareness, but it's that stigma of I'm going to smell, I've got a bag on my side, how's it going to look? Is it plastic tubes? I'm going to have to clear my clothes out. I've been to so many houses where patients have actually, before their surgery, have emptied their wardrobe, and I've come across piles of clothes that are going to go off to the charity shop. So my advice is always, you know, we have to take it slowly. And when I see a patient before an operation, if they're fortunate to get a visit before surgery, we go through, we try and show pictures, and we talk about what the stoma is, and we show products. So because things are so different now to how they were. And the biggest thing is, do not clear your wardrobe, and certainly don't clear your wardrobe immediately after surgery either. Wait, because there's a lot of, I mean, it's always good to spend money, but it's a lot of unnecessary spending going on, getting big baggy clothes, and that's not necessary.
Yeah, thank you. And so therefore, Donna, what would your advice be for how someone could prepare emotionally and mentally when they've had a diagnosis and they know they're having an operation? What do you think would be helpful?
I think it's interesting. I've had a number of clients that have gone through these procedures, and although this is Rachel's experience, there'll be themes for the listeners and for the people that are attending today regarding what they've gone through. But everybody, it's important to remember that everybody's different. So some people will be more relaxed about going into surgery and be worried about other things. But you're talking about going into the unknown, and I suppose giving yourself, letting yourself off the hook, because it's really important that you're kind to yourself in the same way as you would be to somebody else that you care about. I think we can quite often be really tough on ourselves when we're facing it. I've just got to get a grip. And yes, there is some reality in that, because you're pushing through something that is unknown, and you're handing over the care of your body and your future potentially to people that are professional. And that can be quite frightening. So sometimes writing it down can be really helpful, but I would start with the communication of people that you trust around you. Sometimes it can be really hard to let other people in when you're going through something like this. So I would talk to the people that really care about you, and obviously the stoma nurses as well. They've gone through this with so many people before, so asking lots of questions, and some of it will be able to allay your fears, but other times you won't know until you get through the other side of it. So trying to jump ahead, it's small steps. Take each section in small steps.
Thank you. And I really like that you mentioned, sorry, Julie, I'll come to you in a second, but I just want to say I like that you mentioned the idea of writing things down, because as somebody that writes myself a huge amount, I know that the thing about writing, so if you've, with your concerns and fears, it's very easy for them to keep swirling around in your head. What we find with writing something down is it's a concept that we call externalizing your thoughts. So getting it down on paper can help you to get it out of your head, but it can also help you to discuss it with, as Donna emphasized, it's really important to talk to other people about it. So you've got it written down. That can be really helpful. Donna, I'm going to come to you in a sec. I'll just go to Julie first.
Yeah, there's the comments I hear over and over again from people immediately before surgery and afterwards is I need to be grateful. I am grateful. I've got an operation. I can get rid of the cancer or whatever, and I need to be grateful. And then it gives, with some people, this feeling of guilt, I guess. I don't know, that they're feeling so upset about their change in body image, and so that they have this constant battle within themselves of that they must feel grateful, they must, but then on the other side that they're thinking, but why? And it's a real turmoil, and it's about trying to work through that to increase, well, in my mind, to increase their confidence. And nobody has to feel grateful as such. It's about moving forwards and getting on with their life.
Yeah, thank you, Julie. That's really helpful. And Donna, I know you've got something to say on that.
Yeah, I just think it's normal to have a range of feelings around that. You know, Julie's saying, yes, being grateful, but you actually might be really angry as well because of everything that you're having to go through, or frustrated. So there'll be a range of feelings depending on how you are as a person and how you're wired up. But also, some people can shut down. So you might actually feel nothing. You may end up feeling quite numb, and then it will come out potentially later on. And quite often that's what I will see, and colleagues of mine will see that later on down the line, because at the moment you're in survival mode for some people.
Yeah,
Yeah,
so
I think. Oh, sorry.
Sorry,
No, I think
Rachel.
that's sort of happened to me. What also I actually ended up having 2 stoma operations, and the first one was reversed, and then my cancer did return, and I now have a permanent colostomy. But I mean, and thankfully I'm a healthy survivor now, so that's all brilliant news. I think for about 2.5 years, so that's sort of where we're at now. But I think what both Donna and Julie were saying about, I think I shut down, and it was very much originally when I woke up with my ileostomy, I really sort of thought, oh, it's not permanent, you know, and I had quite a few problems getting used to it. It wasn't plain sailing, and I did have a fantastic support from my stoma nurse, Leslie at Fittleworth, as well as the wonderful NHS team. Just have to mention everyone, and you feel so grateful, but you think, what's happening to me? I'm left with this, you know, I've got to deal with these problems, and what clothes can I actually put on that I feel comfortable in? I got all the wrong clothes to start with,
Well,
as Julie was saying.
we'll come to that then. I want to move on to that,
Sorry.
Rachel. I think, but what is clear here is that there's a whole range of emotions and feelings and thoughts before you have the operation, and that they're all normal, whether you're furious, angry and screaming, or the other extreme where you shut down and don't want to talk about it and don't want to say anything. Anything along that spectrum is normal. But I think, yeah, the emphasis on actually maybe writing it down, talking to other people, getting information and help. And I know people will already know about some of the organisations that can support them, and we'll come to those again at the end. But Rachel, you said, so let's move on then to the post-operation part. So yeah, how did you feel about having having your bowel sitting on the surface of your abdomen? I know you've described it to me before as it's a body part outside of you. So what were your thoughts and feelings around that?
Yeah, I mean, I'm sure that anybody who's experienced this will agree with me that it's just so strange. And I did try to prepare myself a bit before the first op with watching some Ostomate videos, who had been very brave, and there's lots of those things out there. That really helped me. However, it took me quite a long time to just even look at my stoma, and it was just really very difficult. But I kind of got on with it, and then it was a little while afterwards that I began to be able to accept it a little bit. But yes, it is something that you. It's not. I didn't find it particularly easy over months and months, really, to get used to having a stoma.
Yeah. So
However, you do learn tips and tricks and all sorts of things which really do help.
okay, so yeah, well, let's ask Julie about that then. You know, what's your advice to people, you know, the first time maybe you see them post-op, what you know, about having this body part outside on the surface of their abdomen, and they're freaked out, or they're again not talking about it. What, you know, what's your experience?
I mean, everybody's different, and obviously each stoma nurse will deal with it in a different way. But when I first see a patient post surgery, and it's about introducing themselves to the body again, and I talk to them. It's a case of that they're not going anywhere until they know how to deal with their stoma bag anyway. So it's a case of taking it at the patient's pace, dealing with the anxieties that the patient, that the individual's talking about, and just being there with them and encouraging them to look and see and not rush. And there shouldn't be a pressure there to sort of say, come on, get out, go to the bathroom. It's a one step at a time process. But what I can say is, once a patient has done that first look, and it's literally looking under the sheets just like that, and or having a feel of the tummy to see what's there. Once you've done that first look, there's an element of fascination, as well as fear, but there is an element of fascination. And I always, and again, everybody's different, but a certain amount of humour comes into the process, because without having a giggle, it can all turn really quite serious and morbid. So yeah, it's a process that you go through, and you're building up that relationship with your patient, your individual, that's sitting there. So I think all these emotions that Rachel talks about are, it goes across the board. Everybody comes out with them in different ways, but it's a scary time, and sitting there learning how to change that bag. When you've done it a few times, you think, for God's sake, why was it so difficult in the first place? But it's something that's very different on you, so it's something that you have to look at and deal with yourself.
I can only imagine you saying about changing the pouch. My only experience, I just remember years ago, you know, when I had my first child, is that, you know, I thought I'm never going to be able to change a nappy properly, and it took, you know, so careful and everything, and then soon you can actually make a meal and change the nappy at the same time before you know, your confidence just rises in your abilities, doesn't it?
It does, and there's no amount of literature or pictures or showing of bags before surgery. There is no amount of that can actually prepare you totally for what you see on your tummy after surgery, because it's something on you, and the look of wonder and awe and all other emotions that I see on people's faces when they look down and they see, and they're like, wow, that is that me? That's the me on the outside. And so it's a case of taking it in, looking and getting to know.
So Donna, tell us about that whole process of, it's interesting, again, a range of emotions, horror to wonder and awe.
Yeah, and I think that's interesting, because when you were talking then, I was remembering either patients that, you know, as a nurse when I was doing my training, where the attitude was, you know, it felt like nobody was talking about it. Nobody particularly asked. You know, this is a long time ago. So I did my nursing training 30 years ago this year. But I think things are slowly changing with people. And you're saying about awe, yes, there is that. And sometimes people end up feeling quite relieved that they've had the surgery. There can be that in there as well. But some people that I've seen as clients have said that they felt disgusted, or they felt, you know, this is now my body. They felt angry, the fact that they were having to deal with that. But then something shifted eventually for them, and they've still got residual feelings around that. It doesn't necessarily mean it goes, especially if it's going to be a permanent fixture. It's about adapting. I don't know how you feel about that, Rachel, but it's about adapting to it. And it is, we keep saying, part of a process, which sounds quite trite at times, but it is. You're going through various times with it. It doesn't mean that you're not going to feel that again. If you're feeling angry, you may go into that, come out, feel relieved, feel, oh God, you know, I'm managing it better. It's a new skill. Like Jill was saying, you know, it's a skill that you're actually learning to deal with this. So I wonder whether, Rachel, if that is the case for you, do you find that it comes and goes, the different feelings in it?
Yeah, definitely. Oh, sorry, I missed that bit.
So I'm just saying, even though you've now got the skill, the feelings, do they change within that process for you?
Yeah, I think they do. Yeah, it's I think I felt that I was going to, one day it was going to be like this, and it's not really the destination, so to speak. It's that cliche of it is the journey, and the different one day you're having, or 1 minute you're having a okay feeling about something, the next it's, oh, I'm really fed up. And it does for me, I have really sort of mixed feelings quite often, I'd say, and this is you know, 2.5 more years down the line. The point that you raised, Donna, about if it's permanent or not, I mean, I think that really hit me actually when I was sort of 6 or 8 months with my first stoma, and thinking, yeah, I can get through this because I'm going to have this reversal operation, and it was more or less definite, and that's what kept me going, really. And it did sort of, you know, once I had my reversal, I was really pleased, but I had quite a few sort of physical problems. Was running to the loo a lot. It took a long time to try and gain bowel control, and it wasn't quite what I thought it was going to be. And plus, you're recovering from these operations quite, you know, it's another operation, another one, depending on, you know, what the reason that you have had your stoma. And then when I actually learnt that I needed a permanent colostomy and stoma, I really felt quite down. I have to say, I thought, okay, you know, and also what Julie was saying about patients saying, I should feel grateful, it's going to be saving my life in my case, and that literally was it. But I did, you know, I really thought, oh gosh, I didn't bank on having one of these for life, you know. It was sort of and so I'm a lot better now. There's certain things that still are in terms of perhaps how I feel about my body image and things like that, you know, maybe never will be the same as what they were. However, I have learned to accept more of how I look now, and I have different sort of products and things to help me manage things. So yeah, it's just really the permanency thought of it. I tended to, you know, just it really hit me then at that moment. And so if you do feel like that, it was completely hit me like that as well. So
Yeah.
I think
yeah, Julie, go ahead.
I think I see it with patients that are told, or people that are told, that they can have a reversible stoma. It does affect their progress post-surgery in the getting out and about situation, because a lot of people will try and sit at home and think, I'm not going out, I'm not going to bother until I've had that reversal, I can wait, and that's what they do. And so I try to I do try to sort of encourage people to set little targets to get out and about. Those that are told from the word go that they're having a permanent stoma, be it a urostomy, colostomy or ileostomy, they view life in a very different way, and it helps for them to progress. You know, this is it, this is me, this is the new me. And we try and sort of say, it's the new and improved you. You know, we've got to get up and get out and do. And it does that they pass that barrier a lot quicker, because it's a permanent thing, so they can focus. But that's not to say that people with a reversible stoma don't get out and about. It's just that their progress is a little different. As you've explained, Rachel, you've been there, you've got the t-shirt, haven't you?
A couple of them, yeah. I mean, I think when I had mine for the first one, I did sort of, it was all about the support that I had as well, and just sort of thinking about my husband, or if it's your partner, wife, family members. Again, I was very concerned about how sort of not just personally, but how other people would view me. And I did find I was sort of people were either tiptoeing around me, or I was sort of quite happy to discuss the things that had happened to me, and maybe perhaps I didn't quite realise that people didn't perhaps want to know too much, you know, when I was dealing with a few problems of leakages or things like that, I'd start sort of saying, oh, you know, oh, I can't get the right pouch at the moment or something, and start to, you know, and so it is quite funny, really, bringing, you know, just to bring in that sort of not the humour, but it does help a little bit to make people relax, really, as well.
Well, yeah, that. So with the other people, Donna, what, you know, what would you say about what I'm wondering about? Yeah, it's interesting that Rachel said, you know, sometimes she realised that some people were like, I don't really want to know that much about it, and then other people would maybe want to talk about it endlessly. So, what would you say about talking to other people about what you've had done or what you're about to have done?
Yeah, I'm quite split with that. I've known Gill a long time, so I think in that situation, there's part of me thinks, well, you know, if people care about you, they would want to. They might have to have a period of adjustment themselves to talking about it. So you have to test the water, but actually, it's you going through it. So my harsher side would say, you know, you would hope that they would meet you with that, but the reality behind it is that some people can't. I would just, again, small steps, talk to the person that's closest to you, and then, you know, the circle can become bigger and bigger. And on that note as well, Gill, I'd like to ask you, Rachel, because we haven't mentioned it yet, but regarding sex and the issue of intimacy after surgery as well, because, you know, I know that more people are talking about it now. So for those of you after this session, there is, as Rachel said, there's a lot on Instagram and there's a lot on YouTube of people that have been courageous, like Rachel is being today, talking about what their experience is, and that does include sex and intimacy, and that's in our journal as well. So coming back to you, Rachel, do you want to make any comment about that? Because I think it is about trusting people and knowing that you're not going to get, you know, because there's something very rejecting, and it puts you off having those conversations if you're watching somebody for their reaction and you don't get an empathic reaction back from the right person. So, you know, your partner, if you've got a partner, or close friends, having those conversations. But how was it for you?
Yeah, I don't mind admitting, you know, that it has taken a long time, and I think I'm again not the same for everyone, but in my experience, I felt very self-conscious about how I looked and how I look, and managing managing how at the right times to feel it was right to, you know, be more intimate, and if you haven't got when you've not got your clothes on, and it just feels it felt absolutely alien. And apart from sort of recovering from surgery and feeling a bit tender and not maybe wanting to be touched and things like that, it's something which I still find difficult. And with the particular operations that I've had, things can have changed, put it that way. So it's something which, you know, even if your partner, husband, wife, whoever, it says you look lovely, you know, I'm still attracted by you. I didn't feel attractive, and often still don't, and that's just something which is I find quite difficult. However, it does help to talk about it, and with you know, particularly with your concerns with your partner. And so I think it is, for me, it had been a slow process, but it is worth being patient and trying to be confident that you will feel better at some point without trying to force yourself to.
Yeah, and is that advice you'd give, Julie, as well, to people if they ask about sex?
Yeah.
And also, Rachel has a partner, but if you were someone that didn't have a partner or were thinking of embarking on a relationship with someone, what sort of questions do people ask you?
It's a big wow, that, isn't it? When you're single, you're out there, you're wanting a partner, and how do I broach that topic? And I think initially, during that recovery process, I always talk about the fact that it's really important for you as an individual, if you're female, to feel feminine, and you immediately think of, you know, you've got a bag, I've got to wear those big knickers. You know, everybody talks about Bridget Jones knickers, those, and so it's about feeling feminine and in the first place, and you know, there's no reason why you can't make yourself feel special with the clothes. So it's signposting people to the right underwear. You know, that there are specially made items of underwear for ladies and men, which and some of them are absolutely beautiful, some of them might be expensive, some of them give you ideas so that you can sort of change things that you've already got to make to fit you. But once you've sort of addressed your body, you've got your feminine underwear, and it's then about being open and honest and with your partner, and you don't, as Rachel says, not everybody wants to be touched straight away, and your body anatomy is changed, so things will feel totally different. So it's doing things slowly and taking it one step at a time, making sure you're comfortable with everything that they do. For a new relationship to start, well, I'm always in total awe and wowed by people that do go out and they have relationships, and they're, you know, I always encourage, be open right from the beginning. It's an important part of you, and it'll always be at the back of your mind until you've opened that can. So being open, and that if the other half is into you as they say they are, then that don't make any difference, does it? So that it's just amazing. People are so strong, and it is amazing. You're stronger than you imagine you are until you've treated this head on.
Yes, Donna.
Yeah, I just wanted to say with the points that you're making there, Julie, that sometimes that people can feel loss of sensation, or with guys, erectile problems, and it might be that will right itself because it's more of a psychological problem rather than the physical, because if they've had surgery and extensive surgery, it might actually affect it. So it might be important to say something about that, Julie.
Yeah, absolutely. Certainly with the gents, when the surgery is deep in the pelvis, it does affect the nerve endings for their erectile function, and certainly as well for the bladder function with both ladies and men. So it's important to be open and honest, the Stoma nurse should ask you about your erectile function before and after. It's a topic that lots of people would rather brush under the carpet. Lots of people say to me, "Oh, I'm not bothered about sex." But no, you might not be now, but you will be in the future. You know, it's one of those things. And as long as people are aware, there are people that we can refer you to should there be erectile dysfunction problems. There is treatments. For the ladies, there's, various different surgeries. If you've had radiotherapy, there's we need to embark on dilators and just to take it slowly. But you don't know until you're informed of that information. So it's really important to have open conversations with your Stoma nurse. Your Stoma nurse is a mind of information. If she doesn't know, she'll know somebody that does. And I'll give anybody £1 million if they can embarrass their Stoma nurse. Honestly, it is true. It's true. We are there. We nothing will faze us. Honestly,
I think that's true. Yeah, I can agree with that.
That's really good to know. I think that in any situation with medical professionals, that people think that they're just someone else, but they're not. You've all heard it as you say, you give £1 million because you've heard it 1 million times. So nothing.
The other thing to mention is with the younger generation now, because we're raising awareness, because there's this social media, the younger generation are putting their photographs out there on social media. They're showing their bodies. Now, it's not everybody's cup of tea, I understand that, but it's about these youngsters. I had a lady who she was a young lady, got home from hospital, straight there on Facebook with a photograph and a big happy smile, because she's embracing herself. It's a new her. She's out there. She's happy because it's there. It's me. It's there to stay, and this is me. And I think that's great. Not everybody's going to do that.
No, but that really picks up on Rachel, what you said to all of us, and Donna's already mentioned the journal for Ostomates that Donna and I have put together for Fiddleworth. But when you contributed a piece to it, Rachel, and you said, and we thought it was so perfect that that's what we've sort of called the journal for Ostomates. You said, "I'm still me, but different." Is that how obviously it's how you feel because you wrote that. Can you tell us a little bit more about that whole concept of being you still but different?
Yeah, I mean, it is exactly that. It's absolutely perfect phrase, because when you've been through different traumas and different things in your life that could be my worst fear, someone else's worst fear, and I'm still here and I'm thriving now, and the different things that have helped get me through it. I still want to be me, but I don't want to not acknowledge that I am a little bit different to what I used to be. But in all, that is a good thing, and I just feel fantastic that I have been able to, over a period of time, accept the things that have happened to me. But I wouldn't say that I would choose it, but I have been able to accommodate what's happened, how I look, and I'm still here, and that's what I'm really thankful for, that I can still have a laugh and a joke, and just have there's a certain part of me that I just feel, well, I mean, I wouldn't be doing anything like this, and I know that's a bit cliche. We've got different opportunities that wouldn't have come up in our lives because of certain things, but I do feel that I have become a lot stronger through it. And I remember my husband saying to me, I think after my first operation, and he said, "Rachel, I don't mind telling you this." He said, "When I knew what you were going to have to go through," he said, "I just couldn't believe it. I thought, I just didn't know how strong you would be." And he said, you've coped with it far better than I thought. And I said, oh, what do you mean? You know, and he said, I just didn't think that you would be able to, recover so quickly or get through this, and just you would still be you. So I said, oh, I am. That's it. You know, I'm just going to be a little bit different.
Yeah, and thank you. And Donna, that whole thing about identity then, because we've all got an identity. Our identity is a collection of ideas about who we are and what we like and what we don't like and what we do and what we can't do. So yeah, your identity changes as it does through all our lives according to what happens in our lives. But can you say a bit more for us about this change in identity, and you know, how do people manage that?
I think it's about learning to adapt to it first of all, look at the feelings that are around it. Sorry, can you say it again, Jill?
Yeah, so just from your take on the whole idea of, you know, I'm still me but different. So yeah, you are still you, but you are different. You're not a completely different person. You know, what's going on for people in their heads when their identity changes?
I think quite often they get stuck and they're frightened about how they're going to manage the next bit. So, you know, you were talking before about having a baby, and I know this is a completely different context, but you know, people say, oh, I'm going to be doing this and I'm going to do that, and actually it changes what you do. You just have to plan it in, you know, and in some ways it's very different, and in other ways it's not different. You have to think ahead about, you know, okay, if I go into town and if I've had problems with it, where can I go to change my bag? You know, who can I talk to about the fact it's really noisy at the moment because I've eaten something that it's going to start gurgling, and it's thinking ahead, and that might be quite exhausting, but actually the process of, you'll get used to it. It's a new skill in going through that, and are you going to let this change fundamentally? So, you know, me as Donna, I'm different in some ways to who I was when I was younger, but in other ways I've still got aspects of me, and we have to attend to them. We have to attend to the bit, you know, if you haven't laughed in a while, why is that you're not doing that? And then what are the things that are going to bring you fun? Who are the people that you're, you know, you talk, Jill, about radiators and drains. So, you know, the people that are going to make you feel good about yourself, and the other people that are psychic vampires that make you feel worse, or they pick on the flaws that you have. So sometimes it's about attitude of, okay, what do I want to do in the future? And is this really going to stop me and define me completely? But I still have to think about that side of myself, because that's the practical.
Thank you. Julie, were you going to add to that?
Yeah, it's sort of that sort of brings into when you were saying about this change when it's noisy, the self-conscious feeling that you have. And we get a lot of youngsters, well, not just youngsters, we have a lot of individuals, you know, worrying about going back to work, going out for a meal, going out to the theatre, you know, if they're on a noisy day or whatever, how are they going to manage? And they sit and they break their hearts talking to me about it and say, how can I do this? I mean, if I'm sitting in the middle of a conference and my colostomy makes a noise, what do I do? And all I can say is I've had numerous stories of people. Well, I've had numerous people worrying about this, and then numerous stories post event, should I say, where people they've dealt with it. So I will never ever say it's not going to make a noise in a quiet situation, because it might do. But you do learn the skill of improvisation. I've had people that call their stomas names. That's an individual thing. They give it a name. And a lady said to me when it trumped during a conference, she said, "Oh, Stanley's making a noise again." Nobody knew who Stanley was.
And what I'm noticing, and what I'm noticing, Julie, is Rachel has been giggling all the way through this.
Yeah. So. I think with me, I mean, this isn't any reflection on the care or the support that I received, but I really I didn't know that was going to happen after the operation and managing in life, and that is something which I suppose I'm quite personal, and I found really so embarrassing. You know, before any of the operations, I would, if my tummy had made a noise in a meeting or in a social situation, I felt, oh gosh, you know, and so I'm probably the worst person to have like something like that happen to me, and I've just had to deal with it. And even now, I can't just deal with it, full stop, that's it. It's not how it goes, is it? And so I do find certain situations still embarrassing. I have been fortunate enough to be able to do a process called irrigation, and that has, you know, it's taken a lot of patience. It helps tremendously with any noises that might come out. But you know, both of my stomas had a name. This one now's a nod to the nurses at the hospital, because they called it's a shortened name, so she's called Maggie now. When Maggie makes noises, I go, oh God, Maggie, quiet please, you know. And if I'm in I think you know, joking aside, sort of in a working situation, I have found that very difficult. And
would you say, Rachel, it's something that, you know, it's interesting. You said that if you were in any sort of group situation, work situation, social situation, and your tummy made noises before, then you found that embarrassing, and now you're realising, crikey, that was as nothing. So your confidence about being amongst other people with maybe the noises that get made, that's, you'd say, yeah, well, tell us, yeah.
Yeah, I mean, I think I did work in a small office until working from home, but I'm sure I'll go back to that situation. I just sort of, you know, I didn't find that I could shout out in the middle of the office, oh, quiet, Maggie, you know, people, what are you talking about? You know, but by this point, they've forgotten that I've got a stoma, which is good in a way. It's not something which in general conversation I would tend to bring up. So what I do personally is, if I feel that that's going to happen, and you know, Maggie's going to start piping up, I'll sort of leave the room if I can, just for if I know it's going to be a situation, let that pass just for a few minutes and come back in, and that makes me feel more comfortable. Other people might deal with it differently, but that's where I've got to at the moment, you know.
Yeah, so the key message you've given us there is you work out ways that work best for you for dealing with things, and if you need support, the same with anything in life really, isn't it, is that however, if we're struggling, we're looking for support and advice and tips. And in fact that moves it on to, you know, as we've just got 10 more minutes now, what would you say, Rachel, what's your advice, and I'll ask each of you this, what's your advice, Rachel, starting with you, for anyone who is going to have a stoma-form colostomy, who knows that that's coming up? What's your sort of top tip?
Top tips. I think try and once you are knowing that's happening, try, as I think Donna said, try to be kind to yourself in whatever way you see that being in your emotional health. You'll play through lots of situations, and they ran through my mind. What about this? How am I going to deal with that? And I probably, you know, went round and round in circles. So I think one of my top tips would be just let that happen. Sometimes I found that if I tried to push those feelings away, then it just got worse. Another thing would be sort of that even if people say you will become back to normal, or you don't have to force yourself to feel like that. So just try and let that happen, and seek support, seek help, or even from you know, perhaps somebody outside of your family or friends. That I've found that a bit easier sometimes, and it can help to get. I've found particular clothing which suits me. I saw quite a lot of sort of people who'd say I can wear really tight clothing to keep in the sort of the support of the bag and the stoma, and I just didn't find that worked for me. So I've got the right waistbands, and I know what height to wear the waistband at, and just patience really, because you feel you've got to get it right all at the start, and it just hasn't, it hasn't worked like that for me. And if you can be patient, be not wanting everything to happen at once, then don't give up as well. Just don't give up.
Great. Yeah.
In the end, things will work.
Take the pressure off. Be kind and gentle to yourself. Recognize what it is that you're going through, and get support. So yeah, that's great. Julie, what would your, for anyone that, what's your advice for anyone who is going to have a stoma form colostomy?
So embrace the information that you're given. The stoma nurse is there. If you get a chance to speak to the stoma nurse beforehand, she'll always give you a contact number, so you'll never remember every question when you first see her. So she gives you a number for a reason. Give her a ring, ask her. Remember that we all focus on, I just want to be normal. But who's normal? You've got people out there that have had mastectomies, people out there that have had their legs taken off, arms taken off. Nobody's normal. So it's about, as Rachel said, the new you, and being kind to yourself. You're embracing the future, and it's something for you to embrace with your stoma nurse and any nearest and dearest that's willing to do the journey with you. Just be kind to yourself.
Oh yeah, and just to add to that, I one thing that I never did and haven't really done is mix with other ostomates. Not because I'm not sociable, but I just haven't sort of had much of the opportunity. So that's something which may have helped me that I haven't really done.
It's
I don't know if other
invaluable.
people tend to do that.
Yeah. Okay. So and Julie, one of the key things I picked up there from you is that no question's too silly. Again, you've heard everything, been asked everything. People are given a number for a reason. It doesn't matter what the question is. Nothing's too silly or too small.
Yeah, we'll talk about anything: sex, positions, poo, wee, everything. We'll talk about it. Fine.
Thank you. And Donna, what would your advice be for anyone who about to have surgery?
I was just to reiterate what Julie was saying there. I don't know any sort of nurses and doctors that are really shocked easily, and it's really important to have those conversations. I think one step at a time. Don't expect yourself to run a marathon. You wouldn't expect somebody to get up and put their joggers on and go off. In the same way, don't expect yourself to emotionally have moved through this. Take a steady pace with it. When we were talking about writing things down, I would really suggest doing a journal, and whether it is words, or for some people they're more pictorial, or they relate more to music. So that can be a really good way to express how you're feeling, and sometimes it can be really dark images, other times it can be images of hope. So I would concentrate on what has gone before, all of the feelings associated with that, but also looking at the hopeful things. What do you want to do when your body has recovered a bit to get through this? What are the things you're going to look forward to? And then again, as you said, Julie, self-compassion, because I think we can be quite brutal with ourselves. And if you had your best friend going through it, what would you be like with them? And that's, our body we live in our bodies. So this is our best friend. So looking after it with food, and the food that you like to eat, being a little bit naughty, being aware of what it is that you can and can't. And it's going to be a process, as you know, Rachel, in finding out what is going to be more helpful to eat. But if you keep your body as healthy as you can, it's going to carry you through until you're feeling more recovered from this surgery.
Yeah, and I want to come back to something that you said, because I did introduce you, Donna, as an integrative psychotherapist, and you've just mentioned about the arts. And I think that for a lot of us, I don't consider myself as particularly arty or anything, but you mentioned there about, as I had emphasized about writing how you feel down, but about get the crayons out, get the felt tips out, get the paint, your children's paints out, or something to, try a way of expressing yourself that you maybe haven't done for a long time, that people will often be surprised at just how creative they can be.
Well, and you don't have to be good or bad at art. It literally is. You can get some, I've known people that have taken charcoal and a big clump in their hands and gone, this is how I feel, like this. So, it doesn't have to be. That's the critique in us. It's the part of us that critiques ourselves constantly, going, I should be doing better, I should be doing it perfectly. You're just doing it your pace, whether it's going through this journey or whether it's expressing how you feel, but finding a container for that and safe people to talk to about it.
Yeah, great. Well, thank you. And so your top advice, Donna, for the future, for anyone who's had a stoma, a colostomy, any operation like that, how would you advise them to see the future?
Keep talking to people.
Yeah.
Keep the communication open.
Yeah, great. And Julie?
Oh, onwards and upwards. So keep hold of your stoma nurse, talk to her, talk to your friends, have a look at your clothes, don't chuck them out, have a nice little dress up session, just see what's fitting, what isn't, don't write anything off. There's nothing wrong with going out to spend money, but don't spend it unnecessarily. Just look at what you've got in your wardrobe, experiment with your diet, but do it sensibly. And yeah, you've got people there to talk to. Do not block it off. Don't hold back. Speak to us.
Yeah, great, thank you. And Rachel?
Well, I mean, before I initially needed to know, needed to have this operation, I had really, I have to admit, never heard of a stoma. Wasn't quite sure what it was, and we're all called Ostomates. So I think really make your stoma your mate. That's great. It's just you're with it, you're stuck with it, whether you like it or not, but make it your friend, and I think that will help. That's
great.
That's helped me anyway.
Brilliant.
Thank you. And I'd just like to add my own advice for the future for anyone that has been going through a difficult experience. And I think you've all at some point mentioned the idea of small steps. And when it comes to the future, hopefully for everyone, is full of hope, and the way we can actually create our own hope, and that's by identifying small goals, small steps that we want to move towards. And each time we achieve a small goal, whatever that is for you, then you've actually created your own hope. You've achieved something, and you've shown that hope is possible. Hope is always about something for the future. So create some small goals that you can work towards and actually create your own hope, and then look at the achievements that you've made. The smallest ones are all add up to a big one. So I'd like to thank Rachel very much for joining us today, and Julie and Donna. I'd like to thank on behalf of Fittleworth everyone that's attended today. If you do have any urgent medical issues, please contact your stoma nurse or GP. There are additional support networks out there. There's Colostomy UK. They're at www.colostomyuk.org. There's the Urostomy Association. There's the Ileostomy and Internal Pouch Associations. They've also got websites. There's, okay, Julie, you're going to have to say it for me, Mitranov support.
Mitrophanov.
See, I tried to think of it as a Russian way of pronouncing it. I don't know why that came to me, but I still didn't get it right. Okay, there's Mitrophanov support. They have a website. If things are feeling really overwhelming, there is always the Samaritans, whatever the issue or difficulty or problem, and they are there 24 hours a day. On their phone number is 116123. So just to finish by saying that if you have any questions for Donna, Rachel or Julie, then do email us at support@fittleworth.co.uk. They will address the issues that you put forward during our Q&A session on the 7th of May at 9:30. You will be getting an email to give you the link for that. And so I'd just like to say thank you and goodbye.
Thank you.
Thank you.
Thank you.
Thanks. Bye.